Transarterial Chemoembolisation, or TACE, is a highly effective, targeted medical treatment used to manage liver tumors directly at their physiological source. The process begins with high-precision medical imaging to locate the tumor and map out the unique network of blood vessels feeding it. In a high-tech angiography suite, our interventional radiology team carefully plans the procedure, ensuring a minimally invasive approach tailored to each patient. A thin microcatheter is navigated through the arterial system until it reaches the specific vessel supplying the tumor, leaving healthy liver tissue untouched. Chemotherapy-loaded beads and embolic particles are then released. This dual action attacks the cancer while simultaneously shutting off its vital blood supply. We confirm the results immediately with a post-procedure angiogram, ensuring the targeted area is successfully devascularized to halt further growth of the tumor. Over the following weeks, follow-up imaging monitors the tumor's response, which typically shows significant shrinkage and a notable improvement in patient health. TACE offers a focused and effective path for advanced liver cancer care. Please consult with your medical specialist today for more personalized information.